one of the faculty members that we are actually creating a video today to kind of go through a variety of screening tools that you actually may be using in practice, and figured you'd want something to watch just to make sure you're doing it correctly. So I'll be working with Julie, who is my client today.
Hello.
Yes! And so what I'm going to try to do is I will show you exactly how to administer the screening tool, but I also am going to try to use very client-centered language so that way you kind of know how to explain it to your client. Okay, so are you ready, Miss Julie?
I am.
Okay, so just to kind of go from the beginning, if I were the therapist, I would want to come in, introduce myself. Hi, my name is Kelly Riley. I'm your occupational therapist today. Have you ever had occupational therapy?
I have not.
You have not. So do you know anything about occupational therapy whatsoever?
Not much at all.
Okay. Well, occupational therapist's main goal is to kind of figure out what might be preventing you from doing the things that you enjoy doing. So one of our primary focuses are activities of daily living, which actually can be dressing, bathing, grooming, toileting, those kinds of things. Other things we're involved in is how you're doing at work, how you're doing leisure activities, all of that. So really what we would like to do is kind of get down to what might be keeping you from doing those things and make that happen.
Perfect.
Okay, so what I'll be doing today is a lot of screening tools. We're going to be looking primarily at just kind of how the sensory system is, which these are all words you don't have to understand, and I don't expect you to, but I'll be looking at vision, how you sense touch, how you sense pain, look at hand strength, look at how you're moving those fingers, all that kind of stuff.
Okay.
Does that sound like a plan?
Sounds good.
Now, one thing I haven't done, which would be also good for you to do, is if you are having, we're going to go through, like I said, the battery of assessment tools, but you want to find out specifically what might be going on with your client because you want to narrow down those assessment tools. So we're going through all of them, but not necessarily would you administer all of these on one client unless it was truly appropriate to do so. So in these particular screening tools, considering we're going through the battery, I would suspect if there was somebody that had any type of neurological event, such as a stroke, spinal cord injury, those kinds of things, you would probably administer all of these. However, if you had somebody that was like a tendon repair, you may only go to the sensory and possibly the strength ones. You wouldn't necessarily have to look at vision because there wouldn't be a concern on vision. So hopefully that makes sense. So the first one I'm going to administer today is light touch. I have two different things here because my cotton ball looked kind of crazy. I have a little brush, so it's just going to be like a little tickle, but you can use a cotton ball, you can use a Q-tip, anything that has kind of a soft, kind of fuzzy feel to it. And when working with an individual, what you will always do is you will start proximal to distal, so from shoulder to wrist, hand. And the reason for that is if you have had an individual who has had any type of neurological event, any type of regeneration will typically occur closer to the trunk and kind of work itself out. So that is the reason you go proximal to distal. You will always, so like say if Julie had had a stroke, you always want to demonstrate on what we consider the sound, which is the most unaffected side first, just so that they get a good understanding of how the test is administered before you go to the arm that might be affected. So let's say we've done all that and we're just going to now test. So what I'm going to do is I'm going to actually have you shut your eyes, okay? So what you're going to feel is a little brush, okay? So I'm going to, let's say this is the arm that's affected. This would be the arm that's not affected, okay? Do you feel that?
Yes.
Okay, so we've kind of demonstrated that very quick. So now I'm going to go to what is considered the affected arm. So every time you feel a touch, I want you to say yes. Okay?
Okay. Yes. 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 Yes.
Perfect. And that's how you quickly administer that test. The reason you're kind of going in random patterns is you're kind of wanting to look at all the dermatome levels to make sure everything is intact. Okay, so that would be documented as that it was completely intact. Now let's say she was not sensing in an area. What you'd want to do is you'd want to go back and test again to make sure that it just wasn't a random miss. And if indeed it really, she wasn't sensing it, you would note that area on, like, you would have a sheet and you would note that as an area that, or it would be absent. If it were just diminished, and let's say she felt it once but not twice, then you would mark it as an area of impairment. Okay, so now we're on to deep pressure. Okay, we're gonna use, normally I use like a pencil for deep pressure, but we're gonna use the bottom of this little brush. And so it's administered exactly the same way you would do on the non-affected side and then test the affected side. And basically what you're doing, now I wanna make sure, and I'm doing this just to make sure this isn't gonna hurt. Does that feel okay? Okay, yeah. I was gonna say, it feels a little rough, and you always wanna make sure you're not gonna hurt your client. So basically what you're doing is you're putting pressure in, and then you're just wanting to see if she senses it. And just kind of to explain, which I didn't do a good job on the last time, the reason you're having the client shut their eyes is you truly want to see if they're sensing the sensation and not using their vision to help kind of figure it out, because they'll use that system as a backup. All right, so I'm going to have you shut your eyes. I'm going to have some pressure applied, and if you feel something, just say yes.
Okay. Yes. 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 Yes.
Perfect. So that would be completely intact. If she wasn't feeling anything, it would be considered absent. And if she felt some and missed some, you would put like impairment. Okay,